Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatry mental health nurse practitioner, and a doctor in nursing practice. Today's case is: what is the difference between bipolar disorder and borderline personality disorder? Distinguishing between bipolar disorder and borderline personality disorder can be challenging due to overlapping symptoms like emotional instability. However, there are key differences in the nature, duration, origin of symptoms, and response to treatment. Here is a comparison between the two disorders. The type of disorder in bipolar disorder is a mood disorder. In borderline personality disorder, is a personality disorder. The typical onset in bipolar disorder is late adolescence or early adulthood. In borderline personality disorder is adolescence or early adulthood. Duration of mood changes in bipolar disorder is days, weeks, or months. In borderline personality disorder is minutes or hours. The type of mood changes in bipolar disorder is defined episodes of mania, hypomania, or depression. In borderline personality disorder is rapid and intense mood swings, often reactive. Emotional triggers in bipolar disorder are endogenous changes, sometimes without external cause. In borderline personality disorder is highly reactive to relationships and stressful events. The self-image in bipolar disorder is stable outside of mood episodes. In borderline personality disorders is chronically unstable and shifting. The interpersonal relationships in bipolar disorder is problems linked to mood episodes. In borderline personality disorder is intense and stable relationships with fear of abandonment. Impulsivity in bipolar disorder is associated with manic episodes. In borderline personality disorder is constant even without mood episodes. Suicide risk in bipolar disorder is high, especially during depressive phases. In borderline personality disorder is very high, often due to feelings of emptiness or rejection. The main treatment in bipolar disorder is medication, including mood stabilizers, antipsychotics, and antidepressants. In borderline personality disorder, the main treatment is psychotherapy and medications for their specific symptoms. Now let's look at some key clinical differences. The nature of symptoms in bipolar disorder: these symptoms are episodic and might appear without clear triggers. In borderline personality disorder, the symptoms are chronic with intense emotional reactions to external stimuli. The identity stability. In bipolar disorder, personal identity remains stable outside of mood episodes. In borderline personality disorder, the identity is unstable, often accompanied by chronic feelings of emptiness. The treatment for bipolar disorder: patients respond better to medication. In borderline personality disorder, patients respond better to structured psychotherapy, especially dialectical behavior therapy. The diagnostic approach: a comprehensive psychiatric evaluation is essential and should include a detailed clinical history, assessment of symptoms and patterns over time, tools such as mood diaries, and information from family members or prior medical records. In conclusion, bipolar disorder is characterized by episodic, cyclical mood changes not always linked to environmental factors. Borderline personality disorder is characterized by chronic, reactive emotional instability, intense relationships, and identity issues. Comorbidity: both conditions can coexist in a patient, making diagnosis more complex and requiring a deeper therapeutic approach. May the light of truth and supreme consciousness illuminate us, and love transform us. Until next time.